Yes, everybody, this is the Beat London 103.6 FM. It is just gone 6 o'clock, which means it is time for our Brent Health Matters conversation. This is the panel show that we do once a month in conjunction with Brent Council, where we talk about things that are really important to our community. And this week, we are talking about prostate cancer because, of course, it's something that is very important and it affects all of us, whether you are a man, whether you are a woman, whatever you are, prostate cancer always affects us. So this is why we're going to have this conversation today, and I've got a panel and I'm really excited actually for this week because everybody on this panel has got so much knowledge and so much experience that they can bring to the conversation, and we can all learn from it. So just before I introduce them, of course, we have interrupted Karim Battar's Drive Time show to bring you this broadcast, and it's going on until 7 p.m. We have got loads to get through. If you do want to get involved with the conversation, please make sure you hit us up on the socials at the Beat 1036 FM on Facebook, Instagram and Twitter to get involved in the conversations. You can send us your questions and we can make sure that our panel gets them, if not during the broadcast, afterwards, and they will make sure to answer your questions. Right, so I want to get right in now because this is a very important topic. So I am going to introduce my first panel guest. She goes by the name of Dr. Lindsay Williams. Dr. Lindsay, can you hear me? How are you?
I can indeed. I'm good, thank you.
Excellent. Thank you for joining us, of course, in this conversation because it's very important. It's something that we need to highlight in the community, isn't it?
Absolutely, and you're spot on about it. So people assume prostate cancer is just men, men have the prostates, but you're right, cancer will affect the person with the cancer, their loved ones, their neighbours, their community, and that's why it's so important to raise the profile of prostate cancer, but particularly because it is our biggest cancer in the UK is prostate cancer, and everyone thinks, and we get a lot of promotion about breast cancer and colon cancer, but the prostate cancer is our largest for the UK. 1 in 8 men will get prostate cancer.
See, look at that. And just before, there is so much to this, and just before we get into the statistics and why it's important that we have this conversation, can you give us, Dr. Lindsay, a very brief summary, just a little bit about you, what your background is and what your involvement in the industry is, basically?
So I'm a GP by trade, but I have a specialist interest in cancer because I'm the cancer clinical lead for the Borough of Brent. I work with Royal Marsden Partners, who's our cancer alliance for Northwest and Southwest London. So I support all areas of cancer for Brent, but in particular, I focus on public engagement and community engagement. And for us in Brent, that is incredibly important, as you mentioned.
Yes, it is indeed. Thank you so much. You've got a wealth of experience, Dr. Lindsay, and I'm really going to get into that with you in just a moment. But I just want to introduce Trevor. Trevor, how are you? Can you hear me?
I'm all right. I can hear you well. My camera's, nearly use a swear word. My camera's not working, I'm afraid. But that might be a relief for you not seeing me.
That's okay. No worries. Thank you for joining us. Now, can you just tell me a little bit about why prostate cancer is important to you, because you have indeed gotten through it, haven't you?
Yeah, I have. Back in 1996, I had a romance medical at my old firm, and they did a PSA test.
Why?
Can you hear me?
I can hear you, Trevor. Yes, keep going for me.
I had a PSA test, and I said, "What's that?" But thank God I did, because it discovered that I had prostate cancer. That's 27 years ago, and I'm still here because I had that test.
Amazing. Wow. Well, first of all, let's go to Dr. Lindsay just very quickly. So, Dr. Lindsay, could you just give us a little bit of an overview? What is prostate cancer and a little bit of background?
Absolutely. So prostate cancer is a cancer that affects the prostate. So this is a part of the male human body. So women don't have a prostate, but men do.
They change, sorry, Lindsay, they can if they change sex, of course.
Very true.
If a man's changed the woman and kept the prostate, they can still get the cancer.
Very true.
Sorry to butt in.
No, please do, Trevor. You're absolutely right. And I think that's very important this day and age of inclusivity. So you're absolutely right. And it presents, it's a sneaky cancer, as most cancers are. There aren't that many symptoms sometimes. You may think, oh, I need to consider my urine symptoms, but actually a lot of the time it may not present with urine symptoms, and actually that could just be a symptom of an enlarged prostate. And just because you've got an enlarged prostate, it doesn't mean it's cancer. So the best thing to think of with prostate cancer is it's common. 1 in 8 men, however, 1 in 4 men in the Black male population. So this is very significant. And I'm going to hone in on 3 big risk factors. 1, you get it more often when you get older. Okay, so anyone over age 50 is more at risk. Being Black is the other risk. As I mentioned, it goes from 1 in 8 to 1 in 4 when you are Black. And then thirdly, it's family history. So if you have a family history, your granddad, your dad, your brother, and they are your immediate family, that increases your risk. And they're the main things to think of. And that's the important part when you all to take home from this, because you may not have any symptoms at all. And the good thing is, if we catch it early enough, actually, it can be curable. And actually, some people live a very long, healthy life, knowing that they have prostate cancer and watching and waiting, or knowing they have prostate cancer and choosing a treatment option. And they can live very long and well lives, as Trevor here is testament to.
Yeah, I had no symptoms whatsoever. As I said, it was old man's medical, and I knew nothing about it, I'm ashamed to say, but this was in 1996, a long time ago. And they don't have the treatment these days that they did then. I am an advocate of testing. I know the PSA test isn't perfect, although some of the disadvantages of it have been disproved recently. Like, you know, they frightened that with the test you may get infections. That's been overstated, apparently. I'm delighted to say, and the test has been approved, as you know, Lindsay, that you know, it's getting better all the time. And fingers crossed, maybe next year sometimes it will be a test, because they have tests. You know, if you're a certain age, you're supposed to be tested for heart, anything like that, but not for prostate cancer. And of the 12,500 men that died, 10,500 of those are because they were diagnosed late, which is a dreadful figure.
I think that's really important to hone in on that late presentation. Yeah. And that's why it's so important to be aware of your risk. So those 3 risks about the age, about being Black, and about having that family history make you more at risk. So there's that underlying 1 in 8, but we know that that will increase if you have those risk factors. And actually, Trevor, as you talked about the prostate antigen, that's a blood test, a PSA. It's a simple test. You don't need to fast for it, and the GP can do it for you. And actually, you can request that at any point now. We've got clear guidance that it's one piece of a puzzle to prostate cancer. As we know, I've said it's a sneaky cancer. You may not get symptoms, but that prostate specific antigen, that blood test, PSA, is one piece of that puzzle, along with further investigations. But if you think that you may have one of those risk factors, or you're concerned at all, go and talk to your GP. You can request a PSA. Yeah, it's just what we say is it's not brilliant at picking up cancer on its own. That's the thing to remember. And the risk factors is the most important to remember.
Yeah, but you can have it. You can have the cancer. You can have that cancer without those risk factors. Sorry to appear to correct an expert, but it's true. And also, I'm on the street and I meet a lot of people. I gave out over 1,000 leaflets over the weekend. At Waitrose, I won't say where, but and the number of people that don't have any connection to those 3 risk factors and have it, but are also here, and I'm sorry to say this, very, very bad things about GPs. You got no symptoms, go away. You don't waste the time, and all that sort of thing, and that is absolutely scandalous. I know you wouldn't do it, and a lot of GPs wouldn't. But some GPs don't want to know, and they're putting somebody's life at risk. I think it's appalling.
And I think actually, Trevor, I'm going to hone in on the Prostate UK website has a really nice, clear form that helps you have conversations with your GP. So if you may have had a conversation that did not go as you expected it to, as Trevor mentioned, with some experience with some of the people out in the community he's spoken to. Prostate Cancer UK website is brilliant and has this lovely form that helps you have those conversations, that empowers you. And that's exactly what this radio show is all about, empowering our community to take ownership and leadership of their health and their health needs. And so I appreciate that there may be some GPs that may not be as willing, but with the right communication and the way to communicate it, I really can't see how we can't support you in that.
I actually used to volunteer for Prostate Cancer UK, but because of a dispute about the PSA test and the value of it, I now volunteer for Orchid, which is a smaller charity that look after the other two male charities. I'm sorry, male cancers, penile and testicle.
Brilliant. Thank you, Trevor. Yes, that's another great charity. And I do have to say, our charity sector does an amazing job at supporting our community. And I feel that there is more work that we could do in health, in social care, to work with our voluntary sector. And in Brent, that's exactly what Brent Health Matters is all about. It's bringing us all together and taking us out in the community to understand what's happening in the community, and then for us to be able to address ways to help them get better healthcare. So today, you know, we're talking about prostate, but there's a roadshow going on in Brent, on Brent Health Matters, about all different aspects of health, you know, diabetes and cardiovascular disease and all these things. I thought it might be helpful, actually. I do get asked about prevention of prostate cancer, and I'm going to be totally honest with you. No one knows how to prevent prostate cancer.
I don't think good clean living.
That's the general line, isn't it?
Other than that,
live
nothing.
well.
Sad, isn't it?
But we do know that obesity is a risk factor for all cancers. So it would be sensible to look at your weight, okay? And you can use a measure, there's online, it's called a BMI, and it's a measure of your weight. And you can look at that online if you Google it on the NHS website. But the weight around the middle is important. So you know that area right around your tummy, sometimes people call it a tire ring. It's like a rubber ring around your belly. That increases your risk as well. So, you know, you've got the all over obesity, but you do also have that middle central obesity, and that can also increase your risk. People ask as well what foods can reduce their risk. Now, there's lots online, Brazil nuts and seafood and tomatoes. I remember my dad, who is a prostate cancer survivor, eating lots and lots of tomatoes and telling me that he read it online and that's what helps. There is limited evidence and it's not clear. I think tomatoes are great as a source of food. And I think that, you know, Brazil nuts and fish and everything, that's all a balanced lifestyle, and that's what we're aiming for. But actually there is no specific way to prevent other than, you know, keep your body weight down, have a nice healthy diet, and reduce your alcohol and smoking.
And exercise, I suppose.
Yep. Bit of exercise, bit of exercise, but you can't outrun your bad diet, unfortunately.
No, you can't. No, it's when I had it, I was very slim. I used to be a ballet dancer many years ago, many years before I had the cancer, and I was still slim. I'm not anymore, but I was slim. But I still had it because, look, if you're one of those 3 risk areas, yes, it's you can have it without those risk areas. Hello, are you there?
Yep, we can hear you.
It is.
No, you're right, Trevor. You're absolutely right. I think what I'm really trying to, you're right that everyone has a risk.
Yes, to emphasise those 3 risks.
Really do want to, because we know that those 3 definitely increase your risk.
Yes,
and we
definitely.
also know that our Black population are one of the lower populations to engage and come forward to us in primary care and in healthcare.
You also could get it a bit younger if you're Black. 45 is the area, isn't it? If you're Black.
Absolutely correct. Absolutely. And I think what I just want to do is just to empower our community. You know, if you're concerned about your prostate, come in and have a conversation. And like I say, the Prostate Cancer UK website has information, you know, that you can print off or you can take in on your phone to help you have those conversations. And I think the other thing to talk about is, you know, we did say symptoms and you may not have any. Of course, you know, there are some symptoms, like anything related to urination could be one of them. but not necessarily. But the other thing is that we do have to be sensible about the blood test as well, and it is that small piece of the puzzle. So you may come in and see us, and we will have a discussion, and we will talk about the blood test, and we may talk about other investigations and other examinations that we may want to do. But I also want to myth bust here and now about the digital rectal examination. I think that everyone is very concerned about that, and that can be a big barrier to engagement. And I'm very keen to explain and reassure everyone that that is not necessarily has to take place before a referral into a specialist. You can present with your worries, you can present with your risks, you can present and request a PSA, but you do not have to have that part of the investigation if you do not want to, until you go to the hospital and you talk to the urologist about everything, and they can do further investigations without doing that examination. So I think that is a big one to talk about, because I know that is very, very negatively perceived in our Afro-Caribbean population.
It's nothing really. I've had it a number of times. All right, it's not present, and it can be a little painful. But it's a man, it hurts me to say this, but women go to the doctors 5 times as often as men. Men think it's macho not to go. Totally wrong. You're brave if you go. Women, I find it hurts me, and I have to say it again, that women go 5 times as often as men. You're quite right about digital rectum examination, but I can tell you now, it's nowhere near as bad as a lot of men may go. It's not nice, but then having an injection for anything isn't nice.
Yeah, I think that's really important, Trevor, to say that and to reassure the community of men or people that identify as male, that they are concerned about that, and to offer your reassurance that this is something that you've experienced on multiple occasions. But I think it is very important to explain that it may not be necessary, and you do not necessarily have to have it before coming in to see us or before going to see the doctors at the hospital.
No. Sometimes you don't have it anyway, but it is important. I'd say it's being brave. It's not being brave, it's being practical to have these things. But you needn't. The blood test, I've always believed in it, because as far as I'm concerned, it saved my life. It's enabled me to look after my daughter. It's a lot of health problems. We brought up our grandson from when we were 55. We wouldn't have been able to have done that. I've been married 60 years this year. And we wouldn't, because we can't see me, you miss the opportunity to say I don't look my age. But the point is, I wouldn't have had those things if I hadn't had the test.
Yeah. And you're absolutely right. You have the right to have that test. You absolutely have the right.
Better tested than permanently rested is one of my favourite sayings as far as the cancer is concerned.
That is a very nice saying. I'm going to steal that, Trevor, unless you're going to copy
use it as much as you like, because it's true. And it may be that you think you may have the symptoms, which do happen, but not as common as you think, and blood in the urine or in the semen, and any trouble with your weeing. But that doesn't necessarily mean that. It could be an infection. It could be enlarged prostate, because they have very similar symptoms. But you can have no symptoms whatsoever, like me, and a lot of men don't. But better tested than permanently rested. I can't remember where I got that from, but I think I might have made it up myself. But I think it's so pertinent.
Yeah, and I think you're right. You're absolutely right about talking about the other very common things that can present with symptoms like that. And just because you have an enlarged prostate, that doesn't necessarily mean it's cancer or it's going to turn into cancer. But I'm a big believer in having all the information available to you and then making decisions. And in order to do that, you have to come in. You have to present to us. You've got to talk to us, so we can then get you the further investigations. We can do that blood test, like Trevor said, and we can get you seen by the doctors at the hospital. And then once you understand what your risk is, whether you have the cancer or not, then next steps on that are a whole nother different thing to discuss. But you've got to get through the door first, and then you can make those decisions.
Absolutely.
I think, Trevor, did you mention about the late presentations, didn't you? You said a lot of our
Okay.
male
I
prostate
read
cancer.
somewhere recently that up to roughly 12,500 men die, 10,500. What a huge percentage of those die because they were not diagnosed in time, which is why it annoys me. You wouldn't do it, a lot of doctors wouldn't do it, but a lot of doctors, maybe because they're busy, whatever, don't, turn people away, and that is, it offends me so much.
Well, hopefully it's changing, because there is a lot of information now going out from public health, from the government, about prostate cancer, and there's a lot of encouragement for us in primary care now to do and offer this test and to consider prostate cancer.
And it's getting better, isn't it? The test is changing, and it's getting better, more accurate all the time.
Absolutely. And hopefully we'll have a screening test. As you did mention, hopefully there will be a national prostate screening test coming. It's gone to a committee, and I'm hopeful. I think you said it, Trevor, for next year, and I'm very hopeful for that too. Yeah, and I think that will be a real game changer, because it goes out and it proactively reaches you. So rather than trying to get you guys to come in and see us, a bit like the bowel screening, it will come to you. Letter comes to you, kit comes to you. It's that idea. So it's that sort of proactive rather than the reactive.
One thing I will say, thankfully, and particularly about with the Afro-Caribbean community, the information is getting out there, and it's helped so very much by celebrities owning up to it, talking about it, persuading people.
I agree.
Thank God you've had them. You can name them, though. But, I'm not a celebrity chaser or lover, but those people that do it are doing a marvellous job. Far more than me as an entity, basically. I won't make that much difference unless somebody talks to me personally.
Do you know, there's an amazing Steve McQueen video. If you YouTube Steve McQueen prostate cancer, it's a 2-minute video, and it is brilliant. And it's got some very big names in it. It's like Morgan Freeman, and
all showing their support. I think I've seen that. I have seen that, Lindsay. Yeah. Can I just ask a very quick question? I just want to interject. Sorry, because this conversation is just so fascinating. Lindsay, is there anything that we can do to educate? As we were talking about the Black Caribbean community, I know there is a stigma there. I know there is an ignorance. Is there anything that we can do amongst ourselves? Like me, I've got Black men in my family. I've got brothers. There are people around me that are Black men and have this view that actually, do you know what? I don't want to go for one because no, that's not right, or it's going to hurt, or for whatever reason. Is there anything that I personally or our listeners can say to these people?
I think the key is that it is a treatable cancer. It is a treatable cancer. We don't, we are very lucky in this day and age to have treatable cancers. As Trevor referenced, he was diagnosed a long time ago. So, prognosis, which is from being diagnosed to your life expectancy, a prognosis is so much more positive now. And that's what it is. You want to live well for as long as possible. That's what we all want to do. We want more time with our family, more time with our children, more time with our communities. And in order to do that, you need to get your bum through the door. We need to see you.
Literally,
we need to get a diagnosis. But I think the big thing is that myth. You do not need to have a rectal examination. You do not need to. You can request a prostate antigen. You can have a discussion, and if you have a family member in particular, if you have any of those high risk factors, we can even get you referred within 2 weeks. It's something called a fast track.
Okay.
It's something called a fast track, or a 2-week wait. When we, as GPs or a healthcare professional in your GP surgery, when we think that you may have cancer, so for example prostate, we make a referral, and you are guaranteed to be seen within 2 weeks. And you are guaranteed within a month to be told whether you have cancer or not. And these are national targets. These are national targets.
That's absolutely brilliant, isn't it?
That's really good. Really good. And that's just kind of a testimony, isn't it, to the work people like yourself, Dr. Lindsay, and the teams are doing, because, to really be able to make sure that we are catching this before it gets serious, and we are treating it, and of course, making sure that we protect everybody. That is just a testament to the work you're doing. So amazing work.
Can I just say something about women's part in this?
Yes,
When
indeed.
I said I did a stand for 3 days running at a supermarket at the weekend,
Yeah.
and when I give a leaflet to a woman rather, I give it to her and say, for the man in your life, you could save his life. And that's
Yeah.
absolutely true. The other thing that I say is nag. I've been married 60 years and my wife's very good at nagging.
Oh, wow.
But also, if necessary, nag and drag. I've heard so many stories from him, and
That's
I
true.
keep on him, but he won't go. And then I keep on him, and eventually he goes. Thank God, I saved his life. And that's not been dramatic.
Yeah.
That's true.
Yeah. Yeah. No, 100%. And I think that kind of feeds into something that I wanted to ask as well about how we support people. You know, if we know somebody, one of our loved ones has got prostate cancer, how do we support them? How can we support them? I mean, what would you say, Trevor? What helped with you? I know you said your wife
Well,
helped you kind of.
my wife was marvellous throughout. It really was. And, you know, one thing I would say, my cancer came back. You know, that's a long time ago in the dark ages. It's done quite often by a robot these days if you're taking it out. But my bit of mine came back 10 years later, so I had to have radiotherapy then. And, you know, my wife was terrific. You've got to be there, maybe cry with them, support them. Women, and not only women, of course, male partners as well, have so much to give to that person with any cancer. If you've got somebody there that can really support you, that's great. And my wife was absolutely fantastic. You know, and it's so be there to help. And the other thing men are frightened of course, that it will affect their sex life. But if they're dead, they haven't got any sex life.
This is true.
And,
this is very true. I mean, yeah.
And even if you don't, even if you can't, you're still there together, sharing life, sharing your family.
This is true.
But
yeah, this is very true.
I think it's also important, Trevor. You've jogged me onto thinking. I wanted to talk a brief bit about treatment. So I'm obviously not a urology specialist. I'm a GP, so I'm a jack of all trades, master of none. But I want to cover this because you talk about, you know, affecting, you know, erections. You talk about sexual function, and I think what we need to remember is there are options available.
Yeah.
Okay, so once you are diagnosed, then there's options. Now, there is an option called watch and wait, and that's where you do active monitoring of the cancer.
Yeah.
Then there's what Trevor talked about. You can have it removed. And he did mention robots. Yes, absolutely. I think it's called the Da Vinci robot, I think, from memory. Very, very snazzy, and reduces that human error. But the other thing is, you could have radiotherapy. So it's interesting. It's, you know, we have a lot of history here on how we've treated it, but you don't necessarily have to have a form of treatment immediately either. I think the important thing is just to get as much information as possible, empower yourself, present, get the knowledge, get it all in front of you, and then make that informed decision with the specialists. And you talked about support. Every urologist and every urology centre that manages prostate cancer always has specialist nurses available.
Yeah.
So you will always have a specialist nurse that you can contact from point of diagnoses. But we also touched on, Trevor, you talked about the charity Orchid, I think that you mentioned. I talked about Prostate Cancer UK. They are available to everyone. They are a free resource.
Or any cancer charity, but those two in particular. I mean, Prostate Cancer UK is huge. Orchid is smaller, but still very, very good.
Yeah. And then, you're right. Like the big ones, Macmillan and Marie Curie, absolutely.
Yeah, but you don't, and it depends what one's in what part of the country. It's interesting. I didn't know this just recently. In Scotland, you have a right to a PSA test. You don't in England. It's a request, but in Scotland, I never knew that till last week, I think it was.
Well, I believe actually, Trevor, it's changed now for us. I believe that if you are over 50, you do have a right now for us in the UK. I think if you're over the age of 45, there's a grey area, and under 45, it's open to discussion. But actually, over 50s now, since the COVID pandemic, you have a right to request prostate antigen blood tests, and that's on the Prostate Cancer UK website. in black and white that you can do that. And it's because our levels of diagnoses post COVID pandemic haven't recovered as much as we were expecting the trajectory to before we had the pandemic, which means that we are underdiagnosing, which means there are a lot of men out there that may have a cancer, that may or deserve a chance to have a discussion about their treatment. And the treatment varies from person to person. Everyone's unique, and everyone is allowed to make their own decision.
Indeed. And this is all really information. Sorry, Trevor, to cut you. It's just a quick one, because we're talking about here making sure that people are aware. Essentially, that's what we want to do. We want to raise awareness on this. We want to get people being proactive when it comes to the examinations, getting tested. And we want to make sure that people know how to support their peers or their family or their friends or whoever's going through it. So when it comes to things like support, I mean, we spoke about the Macmillan and the charities that can help the person going through, but are they the same charities, you might be able to help Dr. Lindsay, that support people that are supporting, you know, the friends and the family of the person that's going through it? Would you say those are the same charities, or are there different resources?
Absolutely, same charities, but also in borough, every borough has a carers association as well, and every borough also offers, so against each hospital, so wherever you go that you get your diagnosis from, they all offer support, and they'll offer support to you as the patient, they'll offer support to your family, so you have that specific support from wherever you get diagnosed, which is the hospital. You then have support out in the community through the borough's carers association. You can also have support, so GP practices, we have access to, you know, counsellors and social prescribers who could also offer some support, or at least signpost you. So it's really about, you know, we always say that it takes a village, and, you know, I think that in this example, well, in cancer in general, it absolutely does. And we know the more support you have and the more involvement you have, the better you do. It helps with your overall mental health. And I think it supports not just you, but your entire family. I know from our experience, each of us had our own individual experience of my father's prostate cancer. And I think that that's where it's important to know what's available to you, and if in doubt, contact those national companies like Macmillan, and you know, but you can go to your GP as well, because we do have in-house, so we have someone called a social prescriber, and they can help support. Or we also have our charities bespoke to boroughs. So in Brent, for example, we have a great Black and ethnic minority cancer charity that would support you. It's a BHM cancer charity that would support you in that journey as the person and as the family. So each borough may have something different. Trevor, you mentioned about, you know, it's, you know, area to area specific.
Yeah, you do.
And you're right, it is.
In Hillingdon, I mean, you've got carers trust in a lot of boroughs, but in Hillingdon, you've got something called H for All, which is a number of charities together that does the same sort of thing as Carers Trust. I mean, I volunteer for them occasionally, but I mean, during lockdown, I was ringing 5 people a week to, you know, because they were lonely. And you can do. We've had a friend that my wife's oldest friend died last year. He was a loner. I'm not a loner. You know, I find it hard. I'm walking the talker. You know, I find it hard to. We haven't socialised much in the last year because of my daughter's problem, and I miss it. You know, most other people think they were right being alone, but the more, and it depends on the individual, but the more hope you can get, because if you've had cancer, it's a big C, isn't it? So if you can get somebody to talk you through it, besides your family, that's terrific. And you mustn't be, you mustn't think you're weak if you do that. You're not weak, you're sensible.
Of course. Fantastic advice there, Trevor. Thank you. And I just want to pull it back just a little bit, for Dr. Lindsay, for you, because, you know, we have listeners here on the Beat London, and a lot of them are younger listeners, of course, they'll be under 50. But I know the vast majority of prostate cancer affects people that are over 50, but it does in some cases affect the younger people, right? So how can we...
Just that, an individual.
Say that again, Trevor, sorry?
Every individual is just that, an individual. There's always an odd person that will get it younger, will get it worse, won't get it at all. You know, we're all different, and our bodies
definitely
are much the same, but maybe a little bit different.
A little bit different. But my thing is, I just want to know, Dr. Lindsay, from you, like, how do we, what would we advise the younger people? Because for those people that are listening and thinking, actually, do you know what, prostate cancer is something that affects the older generation, I'll be fine, I don't need to go for a PSA, I don't need to go for a a rectal examination, or whatever it is. How do we reach out to those people and really try and get them to just be proactive?
I think so. On the Prostate Cancer UK website, or if you just Google it, there's a 30-second check your risk for prostate cancer.
Okay.
And it's a really quick search that you can do. So I would empower every male or person who identifies as male or has a prostate, they need to do that, because that gives you a very clear indication, because there are some people, albeit under 50, will have a very high risk, particularly, for example, an immediate male relative who has died and was under the age of 60. That risk exponentially increases. Okay.
Right.
So we know. So just if you have any immediate relative, it's 2.5 times the risk.
Yeah.
But if you have them and they died under 60, it's a lot higher. And so you definitely need to be seen. So you would sort of bypass, you'd come in, you tell me you've done that risk assessment, you'd even pretty much, I'm just a coordinator. I transit you straight in within a 2-week wait to see the urology team, because it's about know your risk. And then once you know your risk, you then know how often to keep an eye on it, how often to manage it. And in order to do that, you've got to present. We need to know. So Trevor, you're right. You know, we know it's older people, but if you are concerned and you're younger, it can. I have a good example. Today I did a focus group on male health in Harlesden, just up the road at Church End in the Unity Centre. And we had an example of a man, late 30s, with prostate cancer, picked up, total fluke on a well-man check, total fluke, like you were saying, Trevor, you know, PSA checked, and it was high, and they said, oh, it could be because of this, but they referred him in anyway, and it was confirmed. He's had the treatment. Initially, he did have some issues with some erection dysfunction, but now totally back to normal and doing very well.
Wow.
So I think that it's clear. It does. It's not, you're right. It's not just our older population. They are at risk, but it's
the other thing to say is, I heard somebody speak recently, a black guy, that, would you believe his PSA was 400? Over 400. They say that if it's below 5, it should be all right, and, you know, and it depends on the individual. But he had no problems whatsoever. He used to run a lot, and he was finding he was getting a bit tired, had a bit of backache. And in the end, his wife, I think, was needing to go and be tested, and he had prostate cancer. And yet he had none of the other symptoms. It was just getting a bit of backache.
Thank goodness for his wife then, right?
His life stayed, and he's still here. Indeed. I don't think he runs quite as much as he used to, but he's still living a good life. And
that's good. At least he's okay, Trevor.
God.
At least he is okay. At least he's okay. And this is why it's very important, as you were saying, Dr. Lindsay, to kind of do this wellness test that you were saying is on the website. I mean, could you tell us how it works? What do people have to do? How many times do they have to do it? How often? Do you know?
So it's a 30 seconds. You just type in your age, your ethnicity, your family history, and it uses those main risk factors. I think it asks you a few other things. For example, I think the smoking, of course, and the lifestyles. But it gives you an indicator, and then it gives you a do this, talk to this person, or consider repeating this in X number of times. So I think the important thing, and this is new, by the way, this is new. It was launched post-COVID, again, to support with the post-COVID pandemic recovery for prostate cancer diagnosis. Anyone can do this risk calculator. If you've got an iPhone, if you've got a smartphone right now, just type in prostate risk 30 seconds, it will pop up. And if you're doing that at the same time, do the Steve McQueen prostate cancer video, because it is so good and so powerful. And I think that between those two, it will get you thinking, and it will make you think that this is sensible. Trevor, you talked about being sensible. It's sensible. It's empowering. You know, we look after what we eat sometimes. You know, we go to the gym. I think particularly in our young male black population, for example, you know, a lot of them are into gym and fitness.
Into fitness, yeah.
Like I talked about, you can't run off a bad diet. You can't run away from cancer either. Okay. You've got to make those decisions. You've got to make them early, engage, talk to us.
And be proactive. Literally, just be proactive. And just very quickly, because you were saying about you have to put in some of your details and your family history, but what if there are some people that maybe don't necessarily know their full family history? Is there a way that they can get a reading with just maybe some facts?
Hello, I've lost you.
Can you hear me, Lindsay? Sorry, you went quiet there.
Do as much as you can, but if it cannot report for you on that website, come in and talk to us. Okay.
Yeah.
And if you are concerned, like I said, on that Prostate Cancer UK website, it has a form that says to help you have a conversation with your GP, because I know it can be embarrassing. You know, I had a chap only the other day who was trying to talk to me about erectile dysfunction, and we just went around the houses. It was like a game of charades or something. And eventually I just said, "Is your erections?" And he went, "Yeah." And I went, "Why didn't you just say that?" So I think it's just, you know, everyone's embarrassed, everyone's concerned. But you know what? We've heard it a million times over. And I promise you, whatever I saw before you and whatever I'm seeing after you, it's all in a big bundle of it all.
That's exactly what I say. It may be unique to you, but I won't ask you how many male penises you've seen, but it's, you know.
Don't even know. I've lost count, genuinely.
But,
you know, I do so many intimate examinations, but like I said, you don't have to have that intimate examination either. You do not need to have it.
You know, every man, and it works the same with women and their parts, but every man's personal parts, their, you know, genitals are theirs and theirs alone. But to a medical person looking at them, it's just another one of many. A couple of things I say because we're running out of time. One is that you shouldn't just go and have a PSA test and that's it. You should go every year. Would you agree, Doctor?
Yeah, I think an annual check. So a bit like when we do annual health checks now. So they're over 40 now that we offer them in the UK, where you can go and you can have a blood test and a weight and a height and a blood pressure check. So they're called an annual health check. And so we do those annually. So why shouldn't we be able to offer? If you are concerned and you want it, you need to talk to us and we discuss it with you. But absolutely, if that's what you want, we talk about it. And I'm always open to having conversations, and all GPs are. I know that we are rushed. I know that we are stretched. I know that we only have 10 minutes, and that is a challenge for us. And I know that we worked very hard in the pandemic. So I know. So here's the other thing that came up at the focus group. One of the guys said, "Oh, you know, it's just all locums at the moment. It's locum GPs." And I said, "Do you know why? Because the locums are protecting our GP base. Because everyone is working so hard, they're burnt out. So to protect them, we have to have the locum base of GPs that come in and support and offer that support. It is to support us to make sure that we can keep our practices open and running for you. And remember, everything's all electronic. All your records are there. Every discussion you had, we document. Everything that you say, we put in there. So you don't have to repeat it again. So it's important not to, you know,
what couple of things I say that on that. If you live in London, your records might not be obtainable in Liverpool, which is wrong. There should be a national base. The other thing is there's too much emphasis on technology. Because men are over 50, you will have are more vulnerable. You will have people that aren't on the internet. I know that might sound strange.
Yeah, no, that's true.
They're not. And there's too much reliance on. I haven't got a smartphone. Don't want one. You know, too much reliance on texting and the internet rather than you know, doing it more personally, etc.
And I think that's also, I agree, Trevor, and I think that's also where it's good that what Dr. Lindsay was talking about having support and support networks around you, because you know, if you're not on the internet, if you don't have a smartphone, hopefully you've got someone around, whether it's a family member, a friend who's a bit younger, who does and can help you and make sure that you are, you know, going onto the website and doing your check and making sure that if you are feeling any symptoms, they can help you refer yourself to the GP. But I've just got a quick question about your experience, Trevor. I know we've briefly touched on this, but you know, when you go through the process emotionally, what kind of effect does that have? Because a lot of people I know are quite frightened to maybe go and get an examination done, because emotionally they believe that they might not be able to get through it. I mean, I have had this conversation with older people that have been around me, and you know, and they've said, well, actually, do you know what, the reason why I didn't want to go and get it done is because I didn't think that mentally I would be able to deal with it. And you know, mental health is quite a big thing, especially in the Black community. Just generally, I just want to know, emotionally, what was it like for you kind of getting through that?
Everybody's different, but I was stunned, I suppose, when they, you know, once they told me about the cancer. I was stunned. I was worried about the result. But I'm a realist at the end of the day, and it's better to know and have it treated and be safe, which I have been, than not being. And I had terrific support from my wife and some terrific support. I was the first one, and I got a large number of friends. I was the first one in my, you know, my personal community, if you like, to have cancer. My dad died of cancer, some of my family, but you know, I was in my 50s and I had cancer. A cancer that kills 12,500 or thereabouts men every year. But you've just got to face up to it. You want support from your you know, family member, whatever it is. It was that support that enabled me to go through it. But you've got to, better tested than permanently rested, I suppose. You've got to go through it. You've got to look at the alternatives. You've got to look at what you've got to do. But people, I'm not a hero, but I'm lucky to say with support, I found it not easy, that's absolutely daft, but comparatively easy to get through, because I thought it was the right thing to do. Simple as that. And if I've heard, I pray every night, but I'm not a particular religion. I know that sounds daft, I won't go into it. But you know, I remember saying to one guy in England, you know, better, you know, this could save your life. Oh no, God will save me. God needs hope to save people. You know, I think if God had been sitting alongside that guy, he would have said to him, yeah, I can help you, but you've got to do something yourself, you know. So
yeah, no, that's really, really, really useful. And it's quite insightful to hear your perspective, Trevor, because you know, when you actually speak to people that have been through it, it just really, I don't know about you, Dr. Lindsay, but it really just brings it home, and it really hones it in how important it is to speak to someone that's actually been through this, because it's like, if I can help someone else not go through this, if I can help someone else be prepared, if I can help someone else make sure that they are aware of what they need to do, it kind of makes you feel like you want to be proactive. And I think that's why thank you so much, Trevor, for getting involved. That's why it's really valuable to have you on here and kind of sharing your experience. But I have a question, Lindsay. I just want to take it back again, just very quickly, just for our listeners. I just want to break it right down into layman's terms. So for those that don't know, could you just give me a very quick rundown of where the prostate is and how exactly this, you know, this kind of happens, just where on the body? Because a lot of people know that, okay, you used to have to just be able to go through rectally, and now obviously there's the other examination. But just generally, could you just give our listeners just a basic layman's terms rundown of the prostate?
Absolutely. So it's part of the male human body, and it's about a walnut size, and it sits just below the bladder. Okay, so you've got your bladder at the top, and just below it you've got this walnut, and going from the bladder right through the center of the walnut is your urethra. So that's the tract, the tube where your urine comes out of. Okay, so that's why people worry and rightly think that urinary symptoms mean prostate cancer, because of course the prostate is surrounding that tube as your urine's going through it. Now, it's normal to have the prostate, okay? And as we know, with age, it can increase in size. You know, a bit like our noses never stop growing and our ears never stop growing, right? It's going to increase a bit in size. And that's where people can get the problem, because it can squeeze around that tube. But that doesn't necessarily mean cancer. It can just be an enlarged prostate, and we can do some treatment for that. So we can either shave it away, or we can give some pills, some medication that can help to try and shrink it. Now, when it's cancer, it can be in any part of that, you know, walnut, or that sphere, almost that ball. It could be any point of that. It could be on the outside, the inside, the middle bit, the outer bit. And that's why it can vary with the symptoms. And as Trevor said, can have no symptoms, because it might be not that part that's next to the tube where the urine comes out. And so that's when we're talking about that prostate specific antigen, the PSA, that blood test. It's normal to have PSA in your blood because you have a prostate, and it's going to be producing this antigen, and that's normal. Now, what we know is it can also increase, and Trevor rightly mentioned, it can also increase in urine infections after vigorous exercise, after ejaculation. There's lots of other reasons why it can increase, okay? But it can also increase in cancer. And that's why Trevor is promoting it. That's how Trevor's cancer got picked up. That's how a lot of cancers get picked up, is from that increase. And like I said, it's a piece of the puzzle. It doesn't necessarily mean you do have cancer. I've given examples of where it's raised and not cancer. It's a piece of the puzzle, a bit like if we offer you a digital rectal examination, it's a piece of the puzzle. You don't want it, you do not have to have it. And when you go into the hospital, the best thing to do is scan that prostate. And that's what that screening program hopefully is going to look like. It's going to look like a scan. So you can MRI, you can see exactly what that prostate looks like 3D right round it, so you can see if and where that cancer is. Much more sensible than a finger test, than a blood test that can be raised by something else, or then a biopsy where you don't know which part you're going into, because the cancer could be anywhere in that little walnut.
Thank you. That is literally
so one other thing I would say that we missed, both of us missed out. You didn't get any symptoms, but a symptom can be blood in the urine or the semen. We haven't said that, and I think we ought to add it. Could be other things, but it's, I just want to mention that because it could be a factor.
Thank you. Really useful. Right, so I mean, this conversation, I could talk about this for ages because there is so much to it, and it's so fascinating. It's something that we really do need to spread. Just very quickly, just before I ask you both to kind of just give me your key points, your takeaway points from the conversation for our listeners. What do you have, Lindsay? Are there any kind of resources? I know this is in the local community, the Brent area. Are there any local resources or any kind of things that you can personally recommend, or some of the work that's being done in the Brent borough for our residents that you could maybe talk about?
So specific to prostate cancer, like I mentioned, Brent Health Matters is an integration between us in health, our social care colleagues, so the council, and our voluntary sector, so our charity sector. So it brings that all together. It's a specific program of work, and it's a specific program of work focused on inequalities. And as part of that, we are doing regular roadshows. We are moving around the borough week by week. We are coming into the community. We're at libraries, we're in supermarkets.
Nice.
Like I said, I was at the Unity Centre just down the road in Harsden today. So that's the opportunity here, is this is going on in Brent. We are coming out to you. And then what's coming in the future is what we call neighbourhoods. So again, it's us coming to you. So rather than expecting you to come through my door into my GP surgery, we are now going to be working much closer with our charitable organisations. So when you go into them, into that community, they'll start to say, have you thought about prostate cancer? Have you had your prostate? Have you had your PSA? Have you thought about your PSA, etc.? So it's all about the change, the movement. So, COVID was a very, terrible pandemic that affected the world. I think what it also did was it exposed a lot of inequalities. And particularly for us in Brent, we were one of the most affected in the country. And so that's why we have this specific program of work and the specific funding available to do these roadshows. And I, as cancer lead, meet with all of our groups of GPs as practices, and I present at GP forums regularly, and I share all the resources that I produce to help them. So, you know, we have a webinar on prostate cancer that helps with
Amazing.
it. We have some lovely resources. So I have all of that. So if your GP may not be aware and that you're registered to your GP in Brent, you can say, you know, catch up with Dr. Lindsay Williams because she's your cancer clinical lead.
You do
Amazing.
a great job. But
she does do an amazing job. Just very quickly, Trevor, can I get you to just drop one, we've only got 2 minutes left, just one thing that you would like our listeners to take away from this conversation today, very quickly?
Well, besides the fact if anybody wants me to come and give a talk, small community, or have a stand somewhere, I'll be happy, awareness stand, I'll be happy to do that. But I don't think you can think of anything better than better tested than permanently rested. You know, that to me says it all. Don't think you're being macho by not being tested. You're being brave as well as sensible by being tested.
Amazing. Thank you so much, Trevor. And very, very quickly, we've just got about a minute and a half left before Miss Bex comes and takes over the studio. Dr. Lindsay, is there one thing that you would like our listeners to take away from today?
You don't have to have a digital rectal examination if you're worried about your prostate. You do not have to have that.
Thank you so much. Well, that's Dr. Lindsay there and Trevor. Thank you so much from our panel today to talk about prostate cancer. You heard the conversation. It is very, very important that we raise awareness about this and we make sure that we are supporting people and we are being proactive and we are doing what we need to do to make sure that our community is supported, because it's very, very important, as Trevor said, to make sure that you are better tested and well rested. Is that the right way, Trevor? Have I said it correctly?
Better tested than permanently rested.
Permanently rested, words, there you go.
Better tested than dead.
Yes, this is very, very true. So thank you so much, Dr. Lindsay and Trevor. This is the Beat London 103.6 FM. That was the Brent Health Matters in conjunction with Brent Council.